Hi, this is Dr. Eric Thomas talking today about shingles, common name. The correct name these days is herpes varicella zoster because it's caused by the varicella zoster virus. All right, too much information? I don't think so. In any event, it's the same virus that causes chickenpox in little kids, usually little kids. I've seen people in their 20s get it actually. But in any event, this is a slippery little virus. After seeming to clear the system, it actually becomes dormant. It could hide like a little crystalline form somewhere in the nervous system. And after many years, after a person thinks that, well, they've forgotten they even had it, suddenly the virus wakes up. Often, not always, there's some sign. There's what we call a prodrome. Just saw someone who had it and had about 2 days, a day or two, of discomfort just around the upper chest area. This person did not think they had a heart problem, though I think some people would have, but there certainly are instances where people with the feeling of burning, discomfort, will go to an emergency room because they're afraid of having a cardiac heart attack. There are also people who wake up in the morning with it on other parts of their body who think that they burned themselves in a bathtub or something of that nature. But what that really means is that the virus has started to wake up and is growing in the nerves because this virus loves nerve tissue. As you may know, the nerves go to the left or to the right side of the body. So therefore, usually it's localized mostly to one side or the other. The nerves also follow certain patterns. We call them dermatomes. They run down around bands, sort of following the way the ribs run, but they're all over the body. On the face, there's a nerve that has 3 divisions. It's called the Trigeminal Nerve. So a person who has it on the face often will have it in the 1st division and or the 2nd division and or the 3rd division. Well, usually just 1 or 2 out of the 3. Can it go on both sides of the body? Sure, there is some interlacing of fibers, so it can show up a bit on the opposite side. And occasionally, and this is usually when the immune system's not doing too well, the virus can spread through the blood system, and people can have disseminated or widespread blisters. The way that it looks, well, when the virus does eventually reach the skin, usually there are groups or clusters. It's said to be like little grapes of red bumps, and frequently there are blisters there. Sometimes you can see the blisters, sometimes they break right away. How much does it hurt? It really depends on which portion of the nerve is involved. I've seen people literally crying in the office because it is that painful, and I just saw this one individual I'm thinking of who had relatively little discomfort, which is one reason he didn't go to the ER, I suppose, though he knew something was happening. How do we treat it? Why do we treat it? Well, we treat it because it hurts most of the time. Also, if it is treated, we think that it's much less likely that it will go on to leave a permanent, I like to use the word burn, in the nerves, because some people develop ongoing pain that can last 5 years called post-herpetic neuralgia, and that's very difficult to treat. The virus has come and gone. However, unfortunately, the injury to the nerve, this little burn you might say, persists, and that requires treatment with medicines that might otherwise be used for things like epilepsy. And even then, it doesn't always solve the problem. Fortunately, most people do not have such long-lasting pain, but I've seen that quite a bit too. So how do we treat it? Well, fortunately, for the last X number of years, 30 or so, we've had fairly effective to very effective antiviral antibiotics, famciclovir, valciclovir, acyclovir. They are all close relatives. They have slightly different dosages that are used. Well, you put on the right one, and if you put on it in the early stages, the results could be dramatic, as it was with the person I'm thinking of, who started to see results in 48 hours or so with less of a problem. However, initially, way back when, before these were available, it was just a month of pain of varying degrees with pain medicines. Hopefully those days are long behind us. So if you do develop something of discomfort, obviously you haven't looked at, the sooner it's treated the better. Now what about the famous Shingles Shot? Well, I've gotten it. I think it's a good thing to do. It reduces the chance of you developing a reoccurrence of this hidden virus, this Herpes varicella-zoster virus. Doesn't eliminate it completely, but reduces it, and also makes it much less likely that you'll have the post-herpetic, the pain that follows it. What happens if you haven't had the shingles shot and then you get shingles? Well, the person I'm thinking of, actually that was the case. He had discussed having it, never got around to it, had shingles. Believe that that's something you're going to have to discuss with your family doc or your primary care provider, but I would say that in general it is recommended that you still get the shot once you've recovered, since the immune system doesn't always snap into gear with the flare-up. So there you go. Best wishes. Hope that you do well. We have a lot of other videos that I hope will interest you, and I'll do it on the other types of herpes, such as herpes simplex, in the foreseeable. Thanks a lot. This is Dr. Eric Thomas talking.